Tracking Your Health tonight. Back to school means, for some people, back to germs for thousands of families. That's the way it goes.
Yep.
Here with some advice is Dr. Kristen Moffat, infectious disease specialist at Boston Children's Hospital. Good to see you, doctor.
Good to see you too.
All right, let's start first with seasonal viruses. They got an early start last year and were more severe. What are health officials predicting for this season? Because I already know viruses are pretty much in full swing at this point.
Right.
Yeah, some of them are, or they're maybe moving towards being in full swing. We certainly were expecting that we might see a bit more of a typical return to the seasonality of viruses compared with last year, for example, but really only time will tell. We're already hearing about RSV transmission in the southeastern United States. That's a bit earlier than we would typically start to see a rise in RSV transmission, but it's a move at least towards more typical seasonality for that. We have no data yet to suggest that the currently circulating COVID-19 strains or RSV strains in the Southeast are causing more severe disease, but it will certainly be really important to continue to monitor that.
So, doctor, as you know, flu shots are already available. Should parents schedule those now, or should they wait until we learn about the plan for RSV and COVID-19?
Yeah, it is a little bit tricky right now because we are waiting to hear the official word on two interventions that should be available very, very soon. One is this updated COVID-19 booster that will better target the currently circulating strains. We're expecting to hear that will be available in the next few weeks. The other is a monoclonal antibody shot for prevention of RSV in very young infants, and that has been approved and should be available by early October. So what I'm recommending to families is to plan that by mid to late October, they've done everything they can in terms of at least their flu shot, hopefully the updated COVID-19 shot by then. Those two things can be given at the same time. Right. I also would hope families can inquire with their pediatrician if they have a very young infant about prevention of RSV for that infant when it becomes available. And also new to us, families can ask household members or other family members who have contact with their children who are over the age of 60 to talk to their own doctors about a vaccine that's available in that age group now to prevent RSV.
Okay, are you okay?
I'm good.
I love that we have a doctor here.
Thank goodness.
Poor Jessica's been coughing, and this is an old cold, and she does not have COVID.
Don't have any
And
illness.
it's just lingering. So I just would like to help her out here.
Just happens to be. But we are talking about seasonal viruses.
Right,
which,
so there you go. Perfect transition.
But of course, there are other germs out there that spread easily among kids, especially when they're indoors, right, back to school. So what do you expect in terms of what's surging soon or what's next on the list to watch out for?
Yeah, it's a little bit hard to say because there are plenty of pathogens that circulate in a non-seasonal way, which means it's a bit less predictable. But their transmission is definitely encouraged by close indoor contact. So some of those that we see associated with return to school and people being close in indoor and classroom settings include things like group A strep that can cause strep throat. It also can include a number of non-seasonal viruses that can cause gastrointestinal illness. So it's still all good reasons to continue to talk with your children about the importance of hand washing and of not sharing eating utensils or cups or anything that they drink from. I think kids can tend to forget that. And if we're out of the acute phase of the pandemic, they may even be more likely to want to forget that.
Yes, that is well put. Any quick advice for my darling friend Jessica here?
Right?
Yeah, have you tea with honey?
She has it. Where is it? It's right here.
Just finished it down.
There it is.
Get another cup.
I hope you feel better.
Thank
you.
We do.